Question: A 45-year-old man with a history of type 2 diabetes presents with a 1-week history of gradually worsening vision in his right eye. He describes it as a curtain coming down over his vision. On fundoscopic examination, you note retinal detachment with the presence of floating black spots, floaters, in the vitreous humor. What is the most likely diagnosis? A. Retinal vein occlusion. B. Retinal artery occlusion. C. Retinal detachment. D. Macular degeneration. The most likely diagnosis for this patient is C. Retinal detachment. This patient's clinical presentation and fundoscopic findings are highly suggestive of retinal detachment. Here's the rationale for choosing this diagnosis. Gradually worsening vision. The patient reports a gradual worsening of vision in his right eye, which is a common symptom of retinal detachment. Patients often describe it as a curtain coming down over their vision. Floaters in vitreous humor. The presence of floating black spots, floaters, in the vitreous humor is another key indicator of retinal detachment. Floaters occur when the vitreous gel pulls away from the retina, which can lead to retinal tears or detachment. History of type 2 diabetes. While diabetes can increase the risk of various eye conditions, the specific symptoms described by the patient, gradual vision loss, floaters, and the fundoscopic findings are more indicative of retinal detachment. Now, let's consider the other options. Retinal vein occlusion, option A. Retinal vein occlusion can cause vision changes, but it typically presents with sudden, painless vision loss and retinal hemorrhages or cotton wool spots on fundoscopic examination, rather than floaters. Retinal artery occlusion, option B. Retinal artery occlusion is characterized by sudden, painless vision loss, often referred to as an eye stroke. It results in retinal pallor and may not involve floaters. Macular degeneration, option D. Macular degeneration, whether dry or wet, typically presents with gradual central vision loss and distortion of vision, metamorphopsia, but may not involve floaters or the sensation of a curtain coming down over the vision. In summary, based on the patient's symptoms, the presence of floaters, and the fundoscopic findings of retinal detachment, this condition is the most likely diagnosis. Retinal detachment is a medical emergency that requires prompt evaluation and intervention to prevent permanent vision loss.